BRCA-mutated metastatic prostate cancer just got a new first-line standard: PARP inhibitors combined with AR pathway blockers. But when do you sequence them, and which toxicities matter most? From MOASC 2026, Dr. Charles Nguyen from City of Hope answers this question, and many more. In 3, 2, 1. Which HRR alterations derive the clearest benefit from PARP inhibitors in metastatic prostate cancer?
Yeah, we have a lot of PARP inhibitor options for metastatic prostate cancer, both as monotherapy and in combination with androgen receptor pathway inhibitors. In all these studies, most of the benefit is really in those patients with BRCA1 or 2 alterations, whereas we don't really see a big benefit in patients with ATM alterations. So it's really select patients that we really think about these combinations for.
How do the combination data with AR pathway inhibitors change first-line treatment for BRCA-mutated mCRPC?
Yeah. The combinations of PARP inhibitors with androgen receptor pathway inhibitors are really exciting because of the potential synergy of the agent. So this really occurs through a codependent pathway. So when you inhibit the PARP enzyme, you also inhibit the androgen receptor. And conversely, when you inhibit the androgen receptor, you also increase the BRCA-ness phenotype of these patients. So there is potential synergy. So the combinations do improve outcomes for most of the patients, particularly those with BRCA1 or 2 alterations. However, it's the vanishing patient population. So these studies overall, like the PROpel study, MAGNITUDE, and others, they didn't have a lot of patients with prior androgen receptor pathway inhibitor treatment. So it's a bit challenging to use in this day and age, because our patients now have upfront intensification of these agents. So really unclear benefit of patients with prior ARPI therapy.
When should clinicians repeat somatic or ctDNA testing during the course of metastatic prostate cancer?
Yeah. Because of really exciting data of targeted therapies with PARP inhibitors for HRR-positive prostate cancers, we really should be doing a lot of genetic testing for all of our patients at the baseline and also multiple times during the disease course. So that includes germline testing at the initial diagnosis for metastatic prostate cancer, and also NGS testing on tumor tissue, or even ctDNA. I typically repeat the NGS testing during progression to capture any evolving targetable mutations that might open the door for future PARP inhibitor therapies for prostate cancer.
How are you sequencing PARP inhibitors relative to taxanes and PSMA-targeted therapy?
Yeah, we have a lot of treatment options for metastatic prostate cancer these days, more than we know what to do with. So that comes with a challenge of where do we put PARP inhibitors and find that sweet spot for therapy. I do think in general, PARP inhibitors are more effective before docetaxel chemotherapy, whereas where do we sequence it with lutetium, PSMA, and other agents? It's a little bit unclear at this time, but definitely before chemotherapy to really try to leverage that biology early on.
What toxicities require the most attention now that PARP inhibitors are moving into earlier disease settings?
PARP inhibitors mainly have anemia issues. So a lot of patients on PARP inhibitors will have anemia problems, grade 3 often. Many of them will require blood transfusions. And then long-term wise, there is a growing concern of therapy-related MDS or AML that arises from PARP inhibitor therapies many years later. So something to think about when we move PARP inhibitors earlier into the disease course, like hormone-sensitive prostate cancer, where patients are alive and well for many, many years, and they're on the PARP inhibitors for a long time. We do worry about potential overtreatment or overexposure, and with that comes potential toxicities like the anemias and cytopenias.
If you like this video, you may also like the suggested video, MRI's Role in Prostate Cancer Diagnosis, a 3-year study breakthrough. In the description, you will find a link to a web post companion for this video on oncologytube.com. Thank you for watching.